In this video, we are going to discuss important aspects about the study variables. And as we know that the study variables are developed based on the specific objectives, in the sense that for each specific objective, we develop a list of study variables that can be used. So we will know about what is meant by variables, what are the types of the variables, and with examples that will facilitate our understanding for the variables and their importance as as a step forward for data collection. A variable is a characteristic or entity which takes on different values in a study and which can be measured. And anything that can vary can be considered as as variable. Age can be considered a variable because age can take different values for different people for this or for the same individual at different phases of his or her age. For example, an attribute is a specific value on a variable. For example, gender has two attributes, either male or female. Also, we can talk about the variable of agreement, or the agreement variable might be defined as having 5 attributes. One, strongly disagree. 2, disagree. 3, neutral. 4, agree. 5, strongly agree. And we can use it after that in data collection. Sometimes we talk about the indicators. An indicator is an empirical observable measure of a concept. When an indicator is composed of a combination of variables involving only simple calculations, it is called simple indicator. For example, case fatality rate, contraceptive prevalence rate, female genital cutting rate, doctor per population ratio. All these are simple indicators composed of such as multiple regression analysis are used to develop an indicator. Then the result is referred to as complex indicator. For example, if you want to know whether there is a relationship or association between obesity and high density lipoprotein levels in the blood, you can carry out multiple regression with height and weight as the two variable, and to find out if they are related to the high density lipoprotein. Also, we can talk about the variables as regards the or to classify them into qualitative and quantitative variables. We can talk about the qualitative variables that measure in terms of categories such as survival or death, mild, moderate, and severe elevated blood pressure, presence or absence of disease. And also we can talk about dichotomous variable, denotes variables that have only 2 possible values, such as yes or no, male or female, dead or alive, positive or negative. And also we can talk about quantitative variables, and these are the variable measured on numerical scale. For example, we can talk about the weight, the height, the body temperature, the blood pressure, the pulse rate, and respiratory rate, and others. So we have to know before starting data collection, we have to develop a list of study variables based on the specific objective. And this is very important because if the list of variables is incomplete or never developed or so data collection, we are going to collect data that are irrelevant to the specific objective. So it's important that you develop your list of study variables based on the specific objectives. Then we can talk about some quantitative variables are either continuous, such as age, height, blood pressure, antibody titers, blood glucose level, serum creatinine. These are continuous quantitative variables. Other are discrete, discontinuous, such as number of diarrheal episodes per year, number of episodes of acute respiratory infection in a year. Only variables that are directly related to the objective of the study are to be selected. And thus, again, I have to emphasize that you have to develop a list of study variables based on specific objective. That's very important when you come to data collection. If you have a complete list of variables that is based on the specific objective, then the collected data will be of good quality, and also it will be relevant to specific objective. When you go for analysis, then you have the results that are related to the objective and so on. Then we can talk about if too many variables are included, the study will be difficult, and there will be more problems in the data collection later on. As well, quality of the collected data and the results may be seriously affected. In some studies, variables are classified into dependent variables, independent variables, confounding variables, and background, and we're going to discuss every one. When we talk about dependent variables, these are outcome or effect variables. They are the variables in which the changes are the results of the level or amount of independent variables. Also, we can talk about independent variables as input or cause variables. They are the variables that are manipulated or treated in a study in order to see what effect differences in them will have on those variables suggested or proposed as being dependent on them. And for example, a certain study aims to determine the effect of risk factors such as age, nutrition status, presence of smokers in the family on the incidence of acute respiratory tract infections in children under 5 years of age. In this example, the dependent variable is the incidence rate of acute respiratory tract infection, and the independent variables are age, nutritional status, presence of smokers in the family. These examples will make it clear for us to understand what is meant by dependent and independent variables. Now, which was designed to determine the maternal mortality. The aim of the study was to identify the effect of maternal risk factors such as age, parity, nutritional status, smoking, weight, occupation on the incidence of maternal mortality. Then here, the dependent variable is the incidence of maternal mortality. The independent variables are age, parity, nutritional status, smoking, weight, and occupation. Then in another study, the aim of the study was to find out the effect of personal factors among the group of industrial workers on the incidence of work accident. The personal factor studies are age, duration of employment, education level, personality, and job satisfaction. In this example, the dependent variable is the incidence of work accidents. The independent variables are the age, duration of employment, education level, personality, and job satisfaction. Also, we can talk about the confounding, which is a special type of bias, and the effect of the factor under consideration is mixed up with the effect of other factors not directly relevant to the study questions. An important consideration when dealing with confounding is that both factors are potential risk factors for the disease. Which one is the cause and which is the confounding depends on the study objective and the question we are trying to find answer for. For example, when studying the effect of exposure of asbestos dust, working in asbestos mine of lung cancer, cigarette smoking is a confounder or a confounding variable. We know that cigarette smoking is closely associated with lung cancer, and that minors tend to smoke more often than non-minors. On the other hand, the question of interest was the association of smoking and lung cancer exposure to asbestos thus could be a confounder. Confounding is a form of bias, as I have mentioned, and therefore affects the validity of the study, and estimates of the risk coefficients may be systematically higher or lower than the true risk. Adjusting for confounding will improve the validity but reduce the precision of the estimates. When designing a research project, therefore, careful consideration should be given to what are the risk factors of interest and what could be potential confounders, non-risk factors that are of no particular interest in the present study and that might have an association with the hypothesized or the assumed risk factors. The confounding variables or intervening variables, these variables should be studied because they may influence the effect of independent variables on the dependent variables. And confounding variables are of special importance in case control study designs. For example, a case control study the translation between the alcohol consumption and ischemic heart disease. The cases are patients with ischemic heart disease, and the controls are individuals without heart disease as a classical case control. One may find that the case group contained a greater proportion of smokers than the control group, and cigarette smoking is the risk factor of ischemic heart disease. At the same time, smoking is known to be socially and culturally correlated with alcohol consumption. Thus, smoking is a confounding variable as it intervenes or influences the relationship between the ischemic heart disease, which is a dependent variable, and the alcohol consumption, which is an independent variable. The problem can be solved by stratifying the cases and the controls according to smoking status and to look for an association between alcohol consumption and ischemic heart disease separately for smokers and non-smokers. Also, we have to talk about the background variables, and these variables are so often of relevance in investigations or group of or population studies, and that they should always be considered for possible inclusion in the study. Examples of background variables include age, gender, marital status, occupation, socioeconomic status, and such background variables may be dependent or independent according to the study design. These are the important aspects which we like to talk about, and this is the end of this. Next time we are going to carry on discussing the methods of data collection, and but the study variables are very basic for the data collection process and methods, and that we have to develop it based on the specific objectives. Thank you very much.